Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Still, we have 30 plus 30 plus 20, 80 days for the NEETPG. 80 days my promise to you is to give 50 full-scale grant tests, just like the actual NEETPG exam, and also discuss the paper. And I'll also launch 50 ebooks containing PDF of 200 questions with explanatory answers. And that gives you the best practice. Wherever you take coaching doesn't matter. Ultimately, did you practice with Dr. Murali Bharadwaj, attended the discussion, solved the 200 questions in an exam-like condition, putting an alarm, right? You can download the ebook PDF, and then you have mind maps, 200 mind maps of 200 questions, which will give you a consolidated review of all the essential high-yield facts about each of these MCQ. And also we give you keywords which you need to focus on based on every MCQ. If you did wrong in a particular question, there are keywords. Those keyword-related high-yield topics you need to go back and revise. So that is what you need to do. So we do all those analytics. We know what examiner want exactly. And that is what the practice we give. Very nice to see Anita, Ravinder, and many more who are all online. Wonderful students like you are the inspiration for a teacher. In spite of the full day emergency medicine and critical care practice and lots and loads of patients with very high expectations, still before I go to sleep, unless I meet all you wonderful guys, have a little discussion, inspire you to do the revision. Nice to see Abhinaya, Maniraman, Manimaran, and many more who are all online. Can you please punch? Is the voice loud and clear? Keep punching your answers, Doctor. Dr. Nidhi Nautial, and many more. So keep punching your answers, your specific points that you feel like do the revision. Everything keep punching while the discussion is going on. Very good. So let's make the great beginning, Doctor. Yes. This is test number 4 that we are discussing as a part of our 50 mock test discussion for NEETPG 2024 package. So, Doctor, a 45-year-old weightlifter presents with shoulder pain after a bench pressing session. So there is a tenderness and slight bulge in the anterior chest wall. So anterior chest wall is mainly made up of what, doctor? Pectoralis major. So what type of muscle is pectoralis? It is a multi-pennate muscle is what you need to remember. So you should know cruciate, parallel, unipennate and multi-pennate. That's how you will divide the different types of muscles, pectoralis major. Now, nerves of the branchial arch, they're all derived from the neural crest. So it can be asked as a clinical vignette MCQ in the tomorrow's NEETPG. A newborn noted to have facial asymmetry and difficulty with suckling. Which type of cell type from which this pathology originated? So there is a disorder of the craniofacial development predominantly influenced by the neural crest cells is what you need to remember. So you should know all the neural crest cell derivatives. So fundamentally, there are branchial or pharyngeal arches, the arches of the mesoderm covered by the ectoderm and lined by endoderm. Muscular and skeletal development occurred from this. And branchial arch derivatives, neural crest cell derivatives is the key word which you need to be very, very sure about. So what is the type of epithelium the heart palate contained of the keratinized submucosa is what you need to remember. So a 50-year-old with difficulty swallowing and a sensation of dryness in her mouth, dry cracked mucosa, typically it involves the inflammation of the minor salivary glands is what you should remember. What is the tensor of the vocal cord? It is the cricothyroid. So how can a clinical MCQ can come? A professional opera singer comes, difficulty to hit high notes. There are nodules of inflammation, decreased tension. Which laryngeal muscle is the tensor? Indirectly, examiner can ask you, as a clinical vignette, you need to be sure it is the cricothyroid, which is a tensor. Ureteric bud develops from the mesonephros. So a clinical way of asking this MCQ in the NEETPG is an infant has bilateral hydronephrosis, duplication of the ureter. From where is this abnormality arising? The mesonephric duct gives rise to ureteric bud. So any duplication means abnormality in this mesonephric duct is what you have to basically remember. So once more, doctor, the keywords are important. Ureteric bud, mesonephros, metanephric, blastema, embryology of the kidney. They are the things you need to focus if you have done this MCQ wrong, because these are the keywords which are sitting in the examiner's question bank in the tomorrow's NEETPG. A 55-year-old with the history of the hypertension presents with the acute left-sided weakness in the drooping of her right eyelid. Her right pupil is dilated, unresponsive to the light. So we are talking about what? Weber's syndrome. So it is a paramedian midbrain. So you have midbrain, pons, and medulla. Third and fourth cranial nerves come, nuclei are in midbrain. Fifth, sixth, seventh are located in pons. Eighth, ninth, 10th, everything is all in medulla. So through the midbrain only will be passing the corticospinal tract. For example, right corticospinal tract passes through right midbrain, left corticospinal passes through left midbrain. Still, it has not yet decussated. After reaching medulla, it gets decussated to the opposite side. So that is the reason there is a oculomotor nerve causing contralateral hemiparesis. Ultimately, right corticospinal tract goes and supplies the left side anterform cells. So contralateral hemiparesis and ipsilateral oculomotor palsy together because of the midbrain's lesion in the paramedian area, which is called as the Weber's syndrome, is what you need to remember. Very nice to see. Sir, Indian observer here, if you remember, got OBG by your grace, by the God's grace and your hard work, Nidhi. And I'm so proud to know that. So every time some of our earlier prodigal students who have achieved a remarkable rank come to attend these sessions. I'm so happy to see you guys. So very nice to see that you joined Nidhi, the obstetrics and gynecology. Good. So this year I'm expecting Ravinder to be a topper, Anita to be a topper, Abhinaya and many more who are all online to be the toppers. Very good, doctor. So खाली एक चीज याद रखना कि you are born to be a winner. That is what you need to remember to become a topper, doctor. And not a single day lose your spirit. Next 90 days, 80 days pakad lo. 30, 30 and 20. 80 days is the time that you have. And in this 80 days, I promise to discuss 50. Already 3 grand tests are over. This is the 4th grand test. 50 grand tests may 50 into 200. 10,000 questions my discussion karunga. And I promise you 200 out of 200 questions in the tomorrow's NEETPG are going to come from this only. All right, doctor. So today only take opportunity if you have not yet joined to join in the mock test series. Now, doctor, about Simpson's fascia. It is attached to the inner border of the second rib. Another way of asking this question is a patient has got a neck pain, Pancoast tumor. Which anatomical structure is involved? It is the Simpson's fascia, the apex of the lung, likely involved with the Pancoast tumor. Posterior inferior cerebellar artery typically supplies the lateral part of the medulla. So how does it clinically present, doctor? 55-year-old, history of smoking, and hypertension, sudden onset of giddiness, difficulty in swallowing, hoarseness, numbness. All these are the signs of the lateral medullary syndrome of Wellenberg is what you need to remember. Let me take a, yeah. So lateral medullary syndrome of Wellenberg, you should know what are the clinical presenting features. A 58-year-old right-handed man, he has got a difficulty and trouble in speaking for past 2 days. He is frustrated. Short broken sentences means expressive aphasia, otherwise called Broca's aphasia, which is typically located in the inferior frontal gyrus is the location for the Broca's area is what you have to remember. So actual NEETPG में क्या पूछा? एक lumbrical का फोटो दिखा के function of the muscle is what बोल के पूछा. The same thing we reconstructed it as a clinical MCQ. A concert pianist is trying to present with the difficulty extending her fingers during the performance. You notice her fingers can flex at the metacarpophalangeal joints but cannot extend properly at the interphalangeal joint. So what is the shape of the L? Lumbrical, L. So if you put your toe like this, interphalangeal joints are all extended. Metacarpophalangeal joint is flexed is what you need to remember. So inability to extend the interphalangeal joint is the problem whenever there is any lumbrical dysfunction. So the patient is having acute tonsillitis and also disturbance in sensation of taste. That is because of the glossopharyngeal, which supplies the taste sensation, the posterior third of the tongue, and sensory innervation of the tonsil is the one which is affected in tonsillitis is what you need to remember. So during a diagnostic procedure, there's an anomaly around aortic opening, which structure will not be involved. Vagus does not pass, whereas aorta, esophagus, thoracic duct, they all pass to the aortic hiatus is what you need to remember. A 6-year-old boy is brought to dental clinic, yellowish brown film on his newly erupted permanent molars. And what is that called? Nasmith's membrane is what you need to remember. A 22-year-old with history of anorexia nervosa with bradycardia, hypothermia, altered mental status. And his height is 180 centimeters and he weighs 42 kgs. So 42 by 1.8 meters square is equal to 12.96, which is considered lethal and indicative of high risk of mortality. So you need to know BMI value of 13. This was the original NEETPG question. We restructured that into a clinical Binet based. So BMI, lethal BMI, weight status classification by the WHO, anorexia nervosa, these are all sitting in the NEETPG examiner's question bank, doctor. You need to reverse engineer the story and be ready. Which receptors are blocked by myasthenia gravis? Acetylcholine receptors. So myasthenia gravis, acetylcholine receptors, anticholinesterase medication, future में कोई भी MCQ आ सकता NEETPG में, because that is already sitting in the examiner's question bank is what you need to remember that, right? So, yeah. Good. Anita and everybody, keep punching your answers, doctor. To keep it going, to keep the party going. So, 28-year-old, double vision, drooping eyelids, which worsen towards the evening. You should be emphatically sure about your answer. So, it is a classical case of myasthenia gravis. So, what is the characteristic pattern of the brown sequard, doctor? In brown sequard, where there is a hemisection of the spinal cord, there is a contralateral loss of the pain is what you need to remember. So a 30-year-old comes with the loss of the motor function, diminished proprioceptive sensation on the right side, loss of pain and temperature on the left side, below the level of the injury. So this is a classical presentation of brown sequard syndrome is what you should remember. A 72-year-old man with the history of obstructive pulmonary disease. There's a pulmonary embolism. If there's a pulmonary embolism, there will be ventilation, but perfusion becomes zero. That's the reason V by Q ratio become infinite is what you need to remember, because the pulmonary embolism. Once more, what are the keywords that you need to remember? So, ventilation, perfusion ratio, alveolar ventilation, respiratory physiology, pulmonary blood flow. That is how you need to analyze. And remember, for the tomorrow's NEETPG exam. Now, a 45-year-old with a history of the heart failure. So there is a prominent wave. So in heart failure, the C wave is very prominent, which corresponds to the isovolumetric contraction phase. Isovolumetric contraction phase of the ventricular systole is what you need to remember. Now, while you are doing routine EEG, a 24-year-old woman is asked to relax her eyes. So 88 to 13 hertz means It is the alpha waves. Alpha waves. Alpha waves typically occur whenever you are in a relaxed wakefulness. So all the EG waves, you need to be very sure, doctor. 8 to 13 hertz, amplitude of 50 to 100 microvolts typically are linked to decreased level of attention, like relaxed or subconscious thinking is what you need to remember. A 32-year-old woman is brought to emergency. She is tachycardic, hypertensive. Her extremities are very cold to the touch. There's a drop in her hematocrit. What are the compensatory mechanisms? So the patient is in hypovolemic shock. Whenever hypovolemic shock is there, afferent arterioles going to the kidney typically will undergo constriction when the renal plasma flow is less. A medical student is reviewing the kidney. काउंटर करंट मल्टीप्लिकेशन सिस्टम बोल के रहता है हमारे नेफ्रॉन में. So in that, the thick ascending limb of loop of Henle, where active sodium reabsorption occur is involved. Then thin descending limb where passive water reabsorption occur is involved. Medullary interstitium where urea recycling from the collecting ducts is involved. But what is not involved? Thin ascending limb of loop of Henle is not the part of the collecting. The counter current multiplication system is what you need to remember. So, doctor, once more, what are the keywords? Suppose you did this question wrong. You should go back. Sodium reabsorption, urea recycling, counter current mechanism, loop of Henle, renal physiology. Without that, there is no NEETPG, is what you have to remember. Yeah? Now, let's go to the next question. Glucose is absorbed in the intestine by what mechanism? So it is the facilitated diffusion. So facilitated diffusion involves a carrier protein to transport the glucose across the cell membrane. It does not require energy from ATP. Glucose amino acids are commonly absorbed by facilitated diffusion is what you should remember. A pediatrician is evaluating a child who has a stunted growth, low levels of IGF-1. And from where is it produced? It is the liver where the insulin-like growth factor 1 is being produced. Low levels of it is called Laurent's dwarfism, is because of the IGF-1. If IGF-1 is not produced, growth hormone cannot function, is what you need to remember. So, somatomedin, growth factor, stunted growth, insulin-like growth factor, they're all the part of the examiner's question bank. So, आप क्या करना, नीट पीजी में सक्सेस बनना बोले तो PYQs को पढ़ना, रिलेटेड टॉपिक्स क्या है समझना, और उसके ऊपर अच्छा मरम्मत करना उसको. You have to repair those topics. You have to become stronger in those topics for you to become the winner. That is the whole purpose of the preparation. So, what are all the things involved in transport across the nuclear envelope? Across the nuclear envelope, doctor. So, typically, importance, they facilitate transport into the nucleus by recognizing the nuclear localizing sequences. Caveolins are the integrated proteins involved in the receptor-independent endocytosis. Rat proteins like rat IFN alpha are not involved, is what you need to remember. A 30-year-old female patient with a history of iron deficiency. So which protein causes active transport of the iron? Duodenum will be dysfunctional in this patient. It is the DMT1 is what you need to remember. What is DMT1? Divalent metal transporter 1 located at the apical surface of the enterocytes. It also transports zinc, copper, cobalt, manganese, DMT1. It is important for the iron absorption active transport process. Now, doctor, serotonin is also called 5-hydroxytryptamine. Tyrosinosis is due to fumarate acetoacetate hydrolase deficiency. So how does it present? Failure to thrive, signs of liver dysfunction is all because of the fumarate acetoacetate hydrolase deficiency, which is called tyrosinemia, is what you should remember. A 5-year-old boy has a self-mutilating behavior, hyperuricemia, orange-colored crystal deposits in diaper. That's called Lesch-Nyhan's syndrome, which is due to hypoxanthine guanine phosphoriboside, HGPRT deficiency, is what you should remember. 25-year-old complaining of a body odor. Odor worsens with the consumption of certain foods, such as fish and eggs. So what is the enzyme? So this is called trimethylaminiuria, also called fish odor syndrome, due to the deficiency of the flavin containing monoxygenase 3 deficiency, is what you need to remember. Newborn infant with jaundice, hepatomegaly, feeding difficulties, galt deficiency is the galactose 1-phosphate uridyl transferase deficiency lead to the development of galactosemia. So all these are very standard topics, doctor. Totally, there are about 1100 topics which you need to master to become the topper in the tomorrow's NEETPG. A patient has high blood levels of triglycerides. Yeah. So, which is most abundant? Sorry. Yeah. Which is the most abundant product of fatty acid synthesis? Obviously, all fatty acids will burn down to palmitic acid, is what you need to remember. Palmitic acid is what you need to remember. About DNA polymerase 1, it leads to the repair and the repair of any damage also. So DNA polymerase 1 is crucial for the DNA replication, repair, particularly the processing of the Okazaki fragments and replacement of the RNA primers with the DNA during the DNA replication. So every NEETPG you go, doctor, DNA polymerase 1, DNA repair, Okazaki fragment, poly-A gene. So all these things are the hot topics of the examiner. So you should be more hot than the examiner. What is the main function of chaperones? Chaperones will assist in protein folding, is what you need to remember. Any dysfunctional chaperones can lead to many clinical conditions. 25-year-old with angular stomatitis, sore throat, fishy odor despite good hygiene. So basically, it is a vitamin B12 deficiency which present with angular stomatitis, sore throat, and the fishy odor is what you should remember. 45-year-old with hypertension, vinyl mandelic acid means you have to jump and answer pheochromocytoma. 30-year-old with recurrent kidney stones which are hexagonal And also cysteine, ornithine, arginine, lysine, cola is what you need to remember. So that is classical feature of cystinuria is what you should remember. So it is autosomal recessive. It affects the renal tubular amino acid transport. And a defective amino acid transporter lead to poor reabsorption of cysteine, ornithine, lysine, and arginine is what you need to remember. Now, doctor, in the process of coagulation, which amino acid is responsible for the acidic nature of the fibrinopeptides? It is the glutamate aspartate which give the acidic nature to the fibrinopeptides. So once more, fibrinopeptides, glutamate, aspartate, fibrinogen, coagulation, all these funda you need to revise, doctor. So hydroxyindole acetic acid typically is elevated in carcinoid syndrome. It is not at all difficult to answer. Warthin, Finkel-D are typically seen in measles infection, particularly within the respiratory epithelium. Now, CD59 typically is a marker of paroxysmal nocturnal hemoglobinuria, which is a defective GP1 anchor synthesis. So it leads to hemoglobinuria, and RBCs have a specific sensitivity to complement mediated lysis. That's the reason in the night time, when our respiratory rate decreases, typically we go into respiratory acidosis and acid pH typically falls in the night for the plasma. That is the time where complements will go and attack these vulnerable RBCs. That is the reason hemoglobinuria typically is nocturnal in paroxysmal nocturnal hemoglobinuria. CD55, CD59 are the ones Ham's test. You need to remember Ham's test as a diagnostic marker. Which complement component pathway is opsonin? C3b is the opsonin. Bernard-Solier is because of the GP1b deficiency. GP1b. So what is GP1b? GP1b is the receptor for the von Willebrand factor. So you have the vascular endothelium. Here you have the von Willebrand factor. Platelets typically have a receptor for the von Willebrand factor, which is typically called GP1b. If it is deficient, then you call it as the Bernard-Solier's disease is what you have to remember. A 35-year-old woman worries about her increased risk of cancer. There are papillomatous papules. She also has macrocephaly and a thyroid nodule. So what is the gene we are talking about? So basically she is having Cowden syndrome, which is associated with the mutations in P10 gene is what you need to remember. So it is autosomal dominant, multiple hematomatous polyps, high risk for breast and thyroid cancer. Bilateral mastectomies are recommended. If the Cowden is there, is what you should remember. 25-year-old man comes because of a difficulty to release the hand after shaking the hand. That is called myotonia, myotonic dystrophy, you call it as. In this, typically, it is autosomal dominant transmitted. It is chromosome number 19, which you need to remember. So everything, anything about myotonic dystrophy, you need to be very sure. Right, doctor? Characterized by delayed hand grip relaxation. Usually symptoms start by 5th year of age. So all trinucleotide repeat disorders, autosomal dominant conditions, myotonic dystrophy, these are the buzzwords which you need to remember for the tomorrow's NEETPG. 50-year-old developed shortness of the breath, low-grade fever, hypotension 2 hours after receiving a blood transfusion. So what is this, doctor? Trolley. Trolley versus taco. Trolley versus taco is the favorite question of the examiner. Trolley typically presents with respiratory distress within 6 hours of transfusion without any evidence of heart failure is what you should remember. So what is the kidney's response to shock? It will increase the afferent arteriolar resistance by causing afferent arteriolar vasoconstriction. 17-year-old boy comes to ophthalmologist. Brownish discoloration of the corneal margins. What is this called? Wilson's disease. Slit lamp examination for Kaiser-Fischer's ring is what you need to remember. So it is the serum celluloplasmin. Sunflower cataract, where the copper deposits in the posterior capsule of the lens. Hepatic copper levels are elevated in liver biopsy. 24-hour urine copper excretion is elevated. Decreased serum celluloplasmin. And where does copper deposit? Decimex membrane in the cornea. You should basically remember. A 54-year-old male with a history of chronic gastritis presents with a weight loss, anorexia, vague abdominal pain. What are you thinking, doctor? It is peptic ulcer disease. Irregular tubular structures are characteristic of intestinal type of gastric adenocarcinoma. Actually, so that's the reason it is the gastric adenocarcinoma of the intestinal type is what you have to remember now. Right? Now, a 9-year-old boy has a difficulty to differentiate colors. That means color blindness is X-linked recessive disorder is what you should remember. Now, a 25-year-old painless cervical lymphadenopathy, large atypical cells, multi-lobed nuclei, CD15 and 30 markers, no lymphocytic and histiotypic cells. That means it is nodular sclerosis type of Hodgkin's. CD15, CD30 are characteristic of the nodular type. And H and L variety is lymphocyte predominant type. So once more, Hodgkin's lymphoma, classical Reed-Steinberg cell, nodular sclerosis, lymphocyte predominant, lymphocyte depleted, which has got a good prognosis, which is most common type. Everything you should be sure for the tomorrow's NEETPG exam, doctor. Sarcoidosis typically shows non-caseating granuloma. Cat-scratch disease shows stellate granuloma is what you need to remember. So cat scratch is caused by Bartonella henselae. Another way of asking is 10-year-old with a tender swollen mass, small crusted papule, playing with stray kittens. Lymph node show granulomatous inflammation with central necrosis, which is stellate shaped. You should think about Bartonella henselae leading to cat scratch disease. So what is meant by flipping effect? So normally LDH isozymes, if you take, LDH1 exceeds LDH2. If it happens, that indicates myocardial infarction, which is called flipping effect is what you need to remember. So once more, isozymes in MI is a favorite question of the examiner. Why the nude mice are resistant to xenograft? Nude mice is genetically made deficient of T cells because of the lack of the thymus, making them incapable of rejecting the transplant tissues, because transplant rejection is mediated by the T cells. T cells require thymus, which is missing in the nude mice is what you need to remember. A 30-year-old with painless enlargement of the right testicle. On examination, testicle is firm, does not transilluminate. Alpha fetoprotein in normal limits, but beta HCG is elevated, is equal to seminoma is your diagnosis. Changing from one type of epithelium to the other type is called anaplasia, is what you remember. A 29-year-old with amenorrhea, galactorrhea, MRI shows 10 mm pituitary. Prolactin levels are elevated. What is your diagnosis, doctor? Obviously, prolactinoma. Prolactinoma. So, what level of prolactin suggests prolactinoma? Favorite question of the examiner. 200 nanogram per ml. Very confused question. Who will remember? Any prolactin more than 200, definitive of prolactinoma. But you should read prolactinoma, pituitary tumor, amenorrhea approach, galactorrhea causes. They're all the buzzwords for the examiner. Laxative abuse can lead to ammonium urate crystals. Typically, it leads to potassium loss, which can result in compensatory increased production of ammonium. If potassium is not there, ammonium is compensated because ammonium is NH4 plus. This is cation, K plus is cation. So, if K plus loss is there with laxatives, ammonium become more reabsorbed and that forms ammonium urate stones are common with the laxative abuse that lead to loss of K plus is what you should remember. X-ray shows consolidation in the right lower lobe. So it is lobar pneumonia, commonly caused by streptococcus pneumoniae. So pneumonia is divided into lobar, broncho. Third is interstitial. Interstitial is common in viral infections. Lobar pneumonia is caused by less virulent organisms like streptococcus. Broncho is more diffuse in spread caused by the virulent organisms, is what you need to remember. 35-year-old with HIV, with fever, night sweats, dry cough, chest show, small nodular opacities throughout both the lung fields. So it is a classical story of miliary tuberculosis. Invariably, examiner Pranati is asking, sir, shall we use this also for FMG? Yes, Pranati. FMG ho, NEETPG ho, INACET ho, fundamentals are the same. Once you master the fundamentals, you practice 50 full-scale grand tests. You are bound to become a winner. Every grand test, I'll provide you one ebook. Ebook contain 200 mind maps like this. These are all mind maps, where you get in one map all the high-yield facts related, right? And one clinical vignette based question on a non-clinical vignette based concept. So today only join in the 50 full-scale mock test series. Hardly it costs you 10,000 bucks, but you get 50 ebooks to download from learnograph.com and also the discussion. So anywhere you may take coaching, apps you might have had many, you might have large study material, doesn't matter. But ultimately taking these 50 mock tests and attending discussion, solving the papers with the exam timer, that is most important to become the topper in the tomorrow's NEETPG. Right, doctor? So take chance to WhatsApp or call 900868-356 to join the mock test series and discussion of 50 full-scale grants. Now, doctor, sickle cell anemia में क्या होता है? Dactylitis typically will be there. A newborn with undescended testes. So normally, Mullerian inhibitory substance is produced by the Y chromosome, by the Y chromosome. So undescended testis inhibition of the Mullerian ducts is indicative of anti-Mullerian hormone activity, which is typically due to the SRY gene or the Y chromosome, is what you should remember. A 25-year-old with cystic fibrosis with Burkholderia cepacia. So all cephalosporins, doctor, they are resistant. Burkholderia cepacia is resistant. That's the reason meropenem, piperacillin, trimethoprim, sulfamethoxazole, they are all better. Shingles is caused by varicella zoster, which is the reactivation of the chicken pox. Urea breath test is used for H. pylori infection. Hyperacute graft rejection means it occurs within minutes after the graft. It is because of preformed antibodies against the ABO, HLA groups. Preformed antibodies lead to hyperacute rejection. So what is there in the examiner's question bank? Renal transplant, hyperacute rejection, ABO incompatibility. All this you need to be very good in the tomorrow's NEETPG. Australian antigen is hepatitis B surface antigen. The presence of it is indicative of an active hepatitis B. Envelope antigen is an indicator of replication status. So, hepatitis B, Australian antigen, serological markers, HBsAg, these are all in the question bank of the examiner. You have to be ready. You can't say, I am innocent, I did not prepare, means, nahi chalega. 58-year-old, poorly controlled diabetes, left eye, there's a swelling, redness, fever, double vision, diabetic ketoacidosis, there's a proptosis, impaired ocular motility. That is all because of aspergillus, which lead to orbital cellulitis in diabetic individuals. Sabine-Feldman dye test is used for toxoplasmosis. Sensitive and specific for detecting the antibody to Toxoplasma gondii is what you should remember. Acute hemorrhagic conjunctivitis is caused by enterovirus type 70 is what you need to remember. So, Coxsackie virus. Coxsackie virus A24 is a type of enterovirus which can lead to acute hemorrhagic conjunctivitis. A farmer has upper abdominal discomfort, there is a cystic mass in the liver. He was working with livestock. Echinococcus granulosus is typically transmitted from dogs to humans through contact with contaminated feces is what you need to remember. So for Echinococcus, dog is the definitive host is what you should remember. An anaerobe causing multiple abscess, discharging sinuses, sulfur granules. You should only think about actinomycetes. So a 25-year-old, history of recent weight loss, night sweats, and positive for interferon gamma release is an example of tuberculosis is what you need to remember. Which organism commonly lead to bacterial prostatitis? It is E. coli. So examiner can indirectly ask the same by giving you the clinical examination findings. 55-year-old man with fever, dysuria, pelvic pain, swollen tender prostate. Think about prostatitis, which is caused by E. coli, is what you should remember. 32-year-old women with facial flushing, headache, palpitations after consuming seafood meal. So it is all due to the release of the histamine caused by fish products, often related to the bacterium Pseudomonas aeruginosa. Who is the father of microbiology, Dr. Anton von Leeuwenhoek. Cutaneous larva migrans is due to Ancylostoma brasiliense. After kidney transplantation, which organism infection you are worried? cytomegalovirus infection. Post-kidney, once immunosuppression is done, patient develops fever, fatigue, and a low WBC count means think about CMV infection is what you have to remember. Microbial cause of catheter infection, young female is what? Staphylococcus aureus. It is a very common cause of the catheter associated UTI presenting. And 28-year-old with 1 week history of fever, chills, sweat, and splenomegaly. You will only think about what? Plasmodium falciparum. So actual NEETPG में क्या पूछा? They have given a falciparum in the blood smear and asked you to identify banana-shaped gametocytes, which is an endogenous pyrogen. Dr. Prostaglandin E2 is called endogenous pyrogen. A 4-year-old boy, polyuria, excessive thirst, he's not growing well, hypokalemia, metabolic alkalosis, all is called Bartter. Bartter is a problem in thick ascending limb of loop of Henle. Bartter syndrome is like taking loop diuretics. Just like loop diuretics, Bartter also has a problem in the thick ascending limb of loop of Henle with sodium potassium 2 chloride channel, which is inhibited. So just like loop diuretics lead to hypokalemia, metabolic alkalosis, polyuria, polydipsia, same thing will happen. Also, loop diuretics will cause not only potassium, calcium also lost into urine. That lead to growth retardation in Bartter syndrome. So once more, doctor, Bartter, Gitelman, hypokalemia, Liddle syndrome, Gordon syndrome, all this you have to master for the tomorrow's NEETPG. These are all seen in the allergic bronchopulmonary aspergillosis. Pleural effusion, co-occurrence in patient with old cavitary lesion, high levels of IgE. So 35-year-old with asthma, coughing, brownish plaques, transient pulmonary infiltrates, serum IgE level of what? 1200. So that is all suggestive of ABPA, allergic bronchopulmonary aspergillosis. So you have major, minor criteria, diagnostic criteria. Skin reactivity to aspergillus, serum precipitants, elevated serum IgE more than 1000, central bronchiectasis, they're all main. History of brownish plaques, identification culture of the aspergillus fumigatus, late skin reactivity to aspergillus antigen, they're all secondary diagnostic criteria. 70-year-old with hypertension, breathlessness, ECG shows notched P wave. It's called P mitral, is the feature of mitral stenosis, is what you need to remember. Mitral stenosis. Similar question can come. Pseudo P pulmonale. Whenever pulmonary hypertension is there, you get prominent P wave. Even without pulmonary hypertension, hypokalemia also will show a prominent tall P wave, which is called pseudo P pulmonale, which is the feature of hypokalemia. Real P pulmonale is a feature of pulmonary hypertension, tricuspid stenosis, right atrial hypertrophy. They all lead to real P pulmonale. Automatic cardioverter defibrillator in Brugada syndrome. The other day we had a ECG, coving of the ST segment elevation. Similarly, ventricular fibrillation, acute coronary syndrome with a low ejection fraction, in all these conditions, implantable cardioverter defibrillator is indicated. So any Brugada syndrome is one of the indications, is what you should remember. A 10-year-old girl presents with 1 month history of 1 month history of, very good, Ravinder, loose calcium is what you need to remember. Very nice to see 11 online classmates. Very good, doctor. 10-year-old girl with 1 month history of sudden involuntary movements. Past medical history of rheumatic fever. It's called Sydenham's chorea. Sydenham's chorea, which is typically treated by giving valproate, is the drug of choice. So, what are the diagnostic criteria of the NF1, doctor? Freckling, axillary freckling, optic nerve glioma, Lischke nodules, sphenoid dysplasia, a first degree relative with NF1. Acoustic neuroma is not a diagnostic criteria of NF1. Most common site for chronic gastric ulcer is pyloric antrum. What is the time interval between HIV infection and AIDS? At least 10 years is what you have to remember. So, doctor, make it a point. We have 50 full-scale grants. Totally 10,000 MCQs, covering 50,000 high-yield facts. Today only subscribe to 50 full-scale tests plus discussion, useful for FMG, INA CET, NEETPG also. At least 100 questions I promise to discuss. And 200, take it like a test. Solve the paper. Download the PDF. Download the PDF. We will publish it like an ebook PDF. Download it and do the revision, sitting with 2 to 3 friends together. Right? Most important, solve it is important. Many coaching programs start app may question banks, mock tests and all. No one will answer. We will only subscribe. But here, I will make you to do the revision by sitting with you. And I will give the 200 explanations in the form of mind maps. And I give it like a downloadable PDF to you, so that you will get that motivation to do the revision is what I want to tell you. Myocardial stunning pattern. So a 52-year-old ECG has no ST segment elevation, but ventriculogram shows apical ballooning of the left ventricle. What is that called? Tachycardiomyopathy. 56-year-old comes with ventricular fibrillation. A shock is delivered. Epinephrine is given. What is the next step? High dose vasopressin can be used as an alternative to epinephrine is what you need to remember. Patient has cutaneous vasculitis, glomerulonephritis, peripheral neuropathy. Think about Wegener's granulomatosis. Typically, it will be ANCA positive. So, any asthma, sinusitis, rash, joint pain, renal involvement, think about ANCA associated vasculitis. 50-year-old IV drug abuser, proteinuria, hematuria, cryoglobulinemia has an association with hepatitis C infection is what you have to remember. Right, doctor? So, next. Hypokalemic metabolic alkalosis with hypertension. What do you call that as? Liddell's syndrome. Right? It's called Liddell's syndrome, just before we discussed. 68-year-old FEV1 of 25% of predicted FEV1 by FVC of 65%. So any FEV1 by FVC less than 70%, FEV1 less than 30% predicted is the criteria to call very severe COPD is what you should remember. A 70-year-old with a history of smoking with hypercholesterolemia, but his brachial ankle brachial index is unusually high. Actually, in peripheral vascular disease, you expect ABI to be low, but it is high. What is the reason? Whenever there is any arteriosclerosis with a calcified artery, then ABI, ankle brachial index, will be very high. 9-year-old, broad, struggling at school, trouble reading, often reversing the letters. He is easily distracted, fails to complete his homework. He is an example of dyslexia. He has got difficulty with reading, letter reversal. They are all features of dyslexia, which is associated with minimal brain dysfunction. Minimal brain dysfunction is what you need to remember. So where does amphotericin B act, doctor? It acts on the plasma membrane, right? So one more actual exam mein, what is the mechanism was asked for amphotericin B? NEETPG mein. It binds to ergosterol present in fungal cells. It forms micropore, increasing cell membrane permeability. That is how amphotericin B acts. But we recreated another MCQ similar style mein to give you in the mock test. 50-year-old, diabetes, fever, cavity in the right lung. Antifungal was given, but she developed renal dysfunction. So which one it is? Amphotericin B is notorious to have nephrotoxicity. 40-year-old male, chronic hepatitis B and also HIV. He was started on one HIV drug that also led to the hepatitis B control. What is that? Emtricitabine is the NRTI active on both the HIV and also hepatitis B is what you have to remember. So, very good, doctors. Still 11 online classmates, right? In spite of 1 hour, you are holding the mantle is very good. Generally, 15 to 20 minutes, we will not have attention in these online classes. But still 1 hour you are holding means, thanks to be my companion, giving me company to discuss the paper. You are the inspiration for me to discuss. So, doctor, at physiological pH, what percentage of the drug will be ionized? 50% will be ionized, 50% will be non-ionized. Due to the Henderson-Hasselbalch equation, which describes the ionization of the drugs, isoelectric pH, they're all the high-yield topics, pharmacokinetics, pH, pKa, etc. Physiological dose of the hydrocortisone is 10 mg per kg per day is what you need to remember. Pyrenzapine is used to treat the gastric ulcer. Pyrenzapine is a selective M1 anticholinergic drug that specifically inhibits the gastric acid secretion is what you need to remember. 32-year-old with Cushing's syndrome, you have done diagnostic investigation to confirm excess cortisol. So what do? Metirapone test. Metirapone is an inhibitor of the 11-beta hydroxylase to know the pituitary gland's ACTH secretion in response to decrease of the cortisol production. To decrease the cortisol production, we use metirapone is what you need to remember. A 55-year-old with atrial fibrillation, QT interval prolongation is because of quinidine. Quinidine is a drug known to lead to prolonged QT and ultimately Torsades de Pointes. Sotalol, procainamide, disopyramide, phenothiazines, tricyclic antidepressants, they're all known to QT prolongation. When do you call QT prolongation? More than 420 milliseconds. So typically around 600 milliseconds, it can lead to development of polymorphic ventricular tachycardia, which is called Torsades de Pointes is what you need to remember. Niacin therapy is contraindicated in diabetes. Why? Because niacin can lead to the worsening of the hyperglycemia. Endothelin acts on calcium receptors. Is it true? No. Cyclic GMP, not calcium. Actually, original NEETPG may given question, we modified that. The correct answer is cyclic GMP. Cyclic GMP primarily through cyclic GMP pathway. Apixaban is an example of direct X2 inhibitor. So once more, factor 10A inhibitors, classification of the anticoagulants, oral direct thrombin inhibitors, everything you should know, doctor, before you go to the NEETPG. So 80-year-old, which drug is bactericidal? Vancomycin is bactericidal. So you should know the list, doctor. You should know very much the list. Tetracycline, sulfonamides, clindamycin, chloramphenicol, macrolides, and lincosamides are all bacteriostatic. Aminoglycosides, cephalosporins, fluoroquinolones, metronidazole, penicillin, and vancomycin are all bactericidal. Is what you need to. Rata maro, batti maro, rata maro. NEETPG का भजन करना है डॉक्टर, 2-3 साथियों के साथ बैठ के. So what you need to become a topper is not big app subscriptions or big study material to do revision. You require 2 to 3 good friends and subscribe to 50 full-scale grant tests and discussion with 50 ebooks with each containing 200 mind maps, in which 10,000 high yield facts, MCQs are being revised. That is what you need, the practice. 65-year-old with erectile dysfunction, if he is receiving sublingual nitroglycerin, what else you cannot give? You cannot give sildenafil, tadalafil. All fills are not good there. Actually, tadalafil, like other phosphodiesterase type 5 inhibitors, is contraindicated in nitrate therapy because of severe hypotension. A firefighter suffered burns covering 40% body. He weighs 70 kgs. First 8 hours, what should he receive? 4 ml into body weight into percentage. So total requirement is 11,200 divided by 2. Half of it in the first 8 hours. So the correct answer will be A is the correct answer, doctor. Please, one small correction. So what is the definition of posthumous child? A child delivered after the death of their biological father. McNaughton's rule is IPC 84 is what you should remember. Bluish discoloration of the gastric mucosa, emitol sodium poisoning, muscle pain, nephropathy, they're all seen in arsenic poisoning. Which is the first organ to putrefy? Brain is the first organ to putrefy. Locard, principle of exchange. So whenever any crime scene investigation is there, a forensic expert recovers the fibers from the clothing of a victim that match to those found on the suspect's vehicle. So what is the principle? It is called the theory of exchange. The matching fibers exemplify Locard's exchange principle that the suspect was in contact with the victim, transferring fibers to and from the crime scene. When does base-occiput fuse with the base-sphenoid? Between 18 to 22 years. So what is the smell of a mummified body? Mummy is odorless. Mummy is odorless. A patient presented with proximal tubular proteinuria. Classically, it is the cadmium that can lead to proximal tubular dysfunction. So There are various child welfare articles. 21A, right to education. 24, prohibition of child labor. 39, child protection and development. 45, early childhood care. 47, nutrition and public health. But 23 is not related to child, but it is for general trafficking and forced labor. So you need to know all these sections, doctor. With regard to Factory Act, less than 14 years cannot work in factories. No employee. 14 to 18 are called adolescents. Adolescents require fitness certification, maximum 48 hours per week, not exceeding 9 hours per day, compulsory rest after 5 hours of continuous work. They're all the Factory Act recommendations. A community of 10,000 people are being studied for a disease that had an incidence of 2 per 1,000 for a duration of 3 years. So what is the prevalence? 2 into 3? 6. That is incidence into duration will give you. The prevalence is what you need to remember. A healthcare provider is educating community to achieve net reproduction rate of 1. How much should be the couple protection rate? 60% should be the couple protection rate is what you need to remember. So what is that new RNTCP software online to promote TB control program? Nikshai is what you should remember. So doctor, with this, आज हमारा कार्यक्रम समाप्त करेंगे, मगर every day I give the question paper. Before coming to discussion only, please kindly download the PDF, the ebook from learnograph.com. Before that, subscribe to our 50 full-scale grant test series, 50 full-scale NEETPG grant test series by Dr. Murali Bharadwaj, your classmate, roommate, tablemate, benchmate, who holds your hand and takes you on a walk to become a topper. So 2-3 friends you sit, solve the paper. And already I give as mind maps. Easily you can be able to consolidate the topic revision. Find out where you are going wrong. Then शाम को हम सब मिलेंगे and we'll practice together. Like this. 80 days. April garam, May और महागरम, and June rains will come. June 6th is my birthday. So Geminis bring rains. So rains will come. And June 23rd, the NEETPG 2024. Blow the shankha and go to the battle with confidence. Before you go, think, wow, 50 grand tests I took, 10,000 questions I solved and practiced, and the boring discussions I attended on YouTube. I have put Fevicol and sat with determination. Who else will stop me from becoming the winner in the tomorrow's NEETPG doctor? So मजे में पढ़ो, enjoy करते पढ़ो. मैं भूल जाऊंगा बोल के कभी भी सोचना भी नहीं. And I am always there with you, doctor. Feel free to call and contact me anytime for anything that you want. Good night.